that people really respect.
Well, this is all assuming that effectively the best way to save the National Health Service is indeed to put more money into it. But when we're looking at all of these outcomes, so in 2019, the National Health Service produced some of the worst health outcomes that we've seen in all of Western Europe. We had the second highest avoidable mortality rates. So we're talking about people's lives here. We're talking about the fact that the National Health Service in itself is just not achieving the health outcomes that it should be. I think that we need to get rid of the NHS altogether and implement a social health insurance model like we see in countries like Germany, in Sweden, in Denmark. But crucially, this is about ensuring that the British people get the best healthcare that they deserve, and that tax sanity is doing the same thing over and over again and expecting a different outcome.
No, but answer to those other systems.
What we have in Germany, in Sweden and Denmark, the other systems that we just mentioned, yes, they are spending more per capita, but the way that money is being spent is much more efficient, and the reason for that is because patients are able to choose where they get their healthcare from. The National Health Service in this country is a public monopoly. The government choose for you. So as a patient, you get to choose. We are spending almost £200 billion a year on the National Health Service, and our taxes, I think we need to really ask ourselves, is this bureaucratic black hole worth shoveling more taxpayer money into?
Yeah.
Ageing population. And
really worked in the health service, right? It's led by, in some countries, like our, that insulates access to health.
Other systems and other models separate catastrophic healthcare to things that you can shop as a consumer. So we're talking about things like dental care, or talking about immediate things like a heart attack or a stroke. You are going to be receiving that immediate health solutions, but ultimately those solutions will never occur unless we change the funding model. We need to see competition and we need to see choice for patients. We haven't tried that. The National Health Service has remained effectively the same system it has since 1948.
We also tried that in the railways.
It was supposed to be universal access and free for all. We are paying the highest taxes we have since the Second World War, and nobody can access health.